impression is the best impression? Good morning, one and all. Today's topic for discussion is impression techniques in complete dentures. Ideal impression must be in the mind of the dentist before it is in his hand. He must literally make the impression rather than take it. By M. Divan. Impression making is an art. This is a sophisticated procedure which cannot be learned easily and described easily. Impression. A negative likeness or copy in reverse of the surface of an object. An impression of the teeth and adjacent structures for use in dentistry. Glossary of Prosthodontic Terms, edition 9. Complete denture impression. The negative registration of the entire denture bearing, stabilizing and border seal areas of either the maxillae or mandible in a plastic material that becomes relatively hard or set while in contact with these tissues. Now, the basic requirements for making an impression. Knowledge of the basic anatomy, knowledge of basic reliable techniques, knowledge and understanding of the impression materials, skill, and patient management. So these are the basic requirements for making an impression. Impressions can be classified based on the following. Purpose of impression making, based on the theories of impression making, impression techniques, types of tray, method of manipulation of border molding, impression materials. So, based on all these, impressions can be classified. So, based on the purpose of impression making, impressions can be classified into diagnostic impression, primary impression, and secondary impression. So let's see each in detail. Diagnostic impression. From the name, diagnostic. This is an impression made for the purpose of diagnosis, treatment planning, and fabricating diagnostic cast. The materials used here are irreversible hydrocolloids, so used for the purpose of diagnosis, treatment planning, and fabrication of diagnostic cast. Second one is primary impression, also known as preliminary impression. This is made for the purpose of making a preliminary cast on which a special tray is constructed. The materials used here are irreversible hydrocolloids, impression compound, putty, and heavy body elastomeric impression materials. So primary impression or preliminary impression is used for the purpose of making preliminary cast on which a special tray is constructed. So these are the primary impressions made with alginate, impression compound, and elastomeric impression material. The third one is secondary impression, also known as final impression. This is made for the purpose of fabricating a master cast on which the process is fabricated. The materials used here are zinc oxide eugenol impression paste, impression plaster, medium and light body elastomeric impression materials. So secondary impression, also known as final impression, is made for the purpose of fabricating master cast on which processes is fabricated. So the final impressions shown here are with zinc oxide eugenol impression paste, impression plaster, and elastomeric impression material. Now the third classification is based on the impression theories of impression making. Mucostatic, mucocompressive, and selective pressure. Mucostatic impressions, also known as passive, non-pressure, minimal pressure impression techniques. Mucocompressive, also known as pressure impression technique. And the third one, selective pressure technique. Mucostatic impression technique, also known as passive non-pressure impression technique or minimal pressure impression technique. So this is a passive technique. This is based on the mucostatic theory proposed by Henry Page. In this technique, the oral mucosa is recorded in a resting state. Impression is made in an oversized impression tray with spacer. Impression material of choice for this technique is impression plaster. Border molding is not performed here. Hence, the flanges are shorter than other techniques. It is best termed as minimal pressure technique, as it is impossible to record the mucosa with no pressure. So, it is also called minimal pressure technique or mucostatic impression technique. The advantages of mucostatic impression techniques are excellent retention due to closed mucosal adaptation, less trauma to the tissues, and decreased chance of residual ridge resorption. So these are the advantages of mucostatic impression technique. Mucostatic impression technique disadvantages: deprives the denture of maximum coverage within physiological limits. Results in closely adapted dentures but with poor peripheral seal, thereby providing good stability but poor retention. So these are the disadvantages of mucostatic impression technique. Now the second one is mucocompressive impression technique, also known as pressure impression technique, proposed by Green. So this is according to mucocompressive theory. This technique compresses the denture-bearing tissues during impression making. The proponents of this theory perceived that by recording the tissues in a compressed state, they would withstand functional forces which compress the tissues better. The pressure can be manually applied using high viscosity impression materials like impression compound, irreversible hydrocolloids, putty and heavy body elastomeric impression materials. So the materials used here are impression compound, irreversible hydrocolloid, putty and heavy body elastomeric impression materials. Closed mouth functional technique also produces mucocompressive impressions. The advantages of mucocompressive impression techniques are dentures are more stable because the tissues are compressed and the impression is able to record underlying bone contour. So this provides better denture stability. The disadvantages are tissue rebound will cause the denture to raise at rest. The retention is compromised due to tissue rebound. Residual ridge resorption is increased due to pressure on the tissues. So these are the disadvantages of mucocompressive impression techniques. The third one is selective pressure impression technique, proposed by Bauscher. It combines the principles of both pressure and minimal pressure techniques. So it's a combination of mucostatic and mucocompressive technique. So the pressure is applied selectively on areas capable of resisting stress, that is the stress-bearing areas, and reduced from areas incapable of tolerating stress, that is the relief areas. So this is achieved through the design of the custom tray, where non-stress-bearing relief areas are believed only stress-bearing areas contact the tray. So this is the selective pressure technique. The technique combines principles of maximum coverage within physiological limits with intimate contact on movable, loosely attached peripheral tissues and light pressure on weak tissues. So now the impressions can be classified according to the technique, impression technique. So they can be classified into open mouth and closed mouth technique. Open mouth technique. This records the oral tissues in a static state with displacement. The amount of displacement depends on the ability of the different oral tissues to withstand pressure. the amount of space provided for the impression material and the consistency of the impression material. So this is a open mouth technique. With the patient's mouth wide open, the dentist applies controlled pressure on the inserted tray to record the tissues in a static form. So this is done in a static state with mouth wide open. So the disadvantages of this technique are the tissues are not recorded in a functional state. The tissues are recorded in a static state. Now about closed mouth technique. In this technique, oral mucosa is recorded in a functional compressed form. It is assumed that the occlusal loading due to the impression making is comparable to the occlusal loading during function. So this is a functional technique. Occlusal rim or teeth are attached to the impression trays. The impression is recorded while the patient applies pressure and performs functional action like swallowing, grinning, and pursing of the lips. So we can do either swallowing, grinning, or pursing of the lips. Thus, the peripheries of the dentures are established during function. So this is a functional method. Impression materials used for this technique are waxes and soft liners. These are indicated for atrophic ridges. The disadvantages of this technique are difficult to control the amount of pressure, leading to pressure spots. Even occlusion is essential for recording, which may be difficult to establish, and this can produce distorted impression. So these are the disadvantages of closed mouth technique. Now, based on the type of trays used, based on whether they are perforated or individualized, depending on the presence or absence of holes or perforations, depending on whether they are meant for dentate or edentate individuals. So the trays can be classified according to these. Now coming to the first one, based on whether they are prefabricated or individualized. They can be classified into stock tray impressions and custom tray impressions. So these are the stock trays available, metal trays available. They can be perforated and non-perforated too. Stock trays. Stock trays for dentulous patients. These are perforated trays. So the first one is square shaped and the second one is oval shaped for edentulous patients. Stock trays for dentulous patients have long flanges, wide and flat floor, as in the first picture. There is the square shaped one. And stock trays for edentulous patients have short flanges and they are oval and they have narrow floor. So that is for edentulous patients, that is oval shaped. So these are the stock trays for dentulous and edentulous patients. Stock trays are also available in plastic forms. Plastic trays are available. Custom trays. Custom trays are used for the making secondary impressions. The materials used here are cold cure acrylic or shellac base plate or a combination of both. So these are used for fabricating custom trays or individualized trays. They are fabricated in the primary or preliminary cast. Now the third one is depending on the presence or absence of holes or perforations, that is perforated trays and non-perforated trays. Perforated trays and non-perforated trays. These are for edentulous cases. Depending on whether they are meant for dentate or edentate individuals. Dentate means patients having teeth and edentate means completely edentulous. So the trays can be classified into dentulous, edentulous and a combination of both. So this is depending on the whether the patients are dentate or edentate. These are dentate trays, dentulous trays, edentulous trays. Based on the Method of manipulation for border molding. So according to the manipulation of border molding, they can be classified into hand manipulation and functional movements. Hand manipulation using is done by the operator or the dentist. Functional movements are done by the patients according to the instructions given by the dentist. So, based on the method of manipulation for border molding, they can be classified into hand manipulation and functional movements. The last one is based on the impression materials. Impressions can be classified based on the impression materials. The materials used here are reversible hydrocolloids, irreversible hydrocolloids, impression plaster, zinc oxide eugenol impression paste, modeling plastic impression, that is impression compound, wax impressions, elastomeric impression materials, thiocol rubber impression. So these are the basic impression materials used. So impressions can also be classified according to the impression materials used. So to conclude, the basic requirements for making an impression are knowledge of basic anatomy, knowledge of basic reliable techniques, knowledge and understanding of impression materials, skill, and patient management. Thank you.